Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is on a recent New England Journal paper evaluating Abelacimab, a monoclonal antibody which inhibits factor XI, potentially reducing bleeding risk. Study overview. Background: atrial fibrillation increases stroke risk, necessitating anticoagulation. Rivaroxaban, a DOAC, is commonly used but has bleeding risk. The study investigators conducted a randomized controlled trial, AZALEA or TIMI 71. 1,287 patients with atrial fibrillation at moderate to high risks for stroke were enrolled. Treatment groups included Abelacimab 150 mg monthly subcutaneous, Abelacimab 90 mg monthly subcutaneous, and Rivaroxaban 20 mg daily oral. Primary endpoint was major or clinically relevant non-major bleeding. Key results: bleeding outcomes. Abelacimab significantly reduced major or clinically relevant non-major bleeding. In the 150 mg Abelacimab group, 3.2 events per 100 person years, p-value 0.001 versus Rivaroxaban. In the 90 mg Abelacimab group, 2.6 events per 100 person years, p-value 0.001 versus Rivaroxaban. In the Rivaroxaban group, there were 8.4 events per 100 person years. Major GI bleeding was 5 times lower than with Abelacimab. Stroke and thromboembolism. Ischemic stroke rates were slightly higher with Abelacimab. No significant difference in overall stroke or systemic embolism. Conclusions and implications. Abelacimab achieved marked factor XI inhibition with 99% reduction. Bleeding risk significantly lower than Rivaroxaban. Stroke prevention efficacy requires further evaluation. Clinical impact. Potential for a safer anticoagulant with fewer bleeding risk may be preferable for patients at high bleeding risk. Ongoing phase 3 trials, LILAC, that is TIMI 76, will assess stroke prevention efficacy.